Hello and welcome. Today's conversation is brought to you by Sabres Medical at blossomtms.com. We're diving into something that, well, affects so many people, that often difficult search for mental health treatments that really work, especially for things like depression and anxiety. For a lot of folks, it can feel like you're just stuck, maybe trying different things, traditional methods, and hitting dead ends. So today we want to explore a powerful, non-invasive treatment that's really changing how we think about mental health care. We'll help you understand what it is, and maybe more importantly, when it might be the right time to consider it.
That's right. And, for a long time, a treatment like transcranial magnetic stimulation, or TMS, it was sort of seen as maybe the last resort. But what's really fascinating, and this is key, is how our understanding and use of TMS is changing. It's moving much earlier in the care process. We're seeing studies now showing remission rates, sometimes, 2 or even 3 times higher when TMS is considered after maybe just 2 failed medication trials, not 5 or 6.
Yeah.
It's a huge shift.
Wow, 2 or 3 times higher.
Yeah.
That's significant. Okay, let's really unpack that. We're going to look at 3 clear signs, sort of indicators, that suggest it might be time to think about this approach and really get into why timing. Why it seems like timing is just, well, everything for recovery.
Exactly. Our goal is really to give you a clear framework so you can recognize these moments, maybe for yourself, maybe for someone you care about, and understand just how much difference identifying this early can make. It can really shorten suffering and improve outcomes.
Okay, so before we jump into those signs, let's get a clearer picture of TMS itself. Because I imagine for some people listening, transcranial magnetic stimulation, it might sound a bit, I don't know, science fiction, maybe a little intimidating.
It can sound that way, can't it? But actually, in practice, it's quite straightforward and elegant, really. Think of it like a very targeted reset for specific brain circuits. It's FDA cleared, it's non-invasive, it uses these focused magnetic pulses similar to an MRI machine, actually to gently stimulate parts of the brain, typically the prefrontal cortex, that are involved in mood. These are areas often underactive in depression.
Okay, magnetic pulses stimulating the brain.
Right. And the great thing is, it's generally well tolerated. There's no anesthesia needed, no sedation. Patients typically come in for a session, maybe around 20 minutes, and then they can go right back to their day, drive themselves, go to work, whatever it is.
20 minutes, that's quicker than I thought.
Yeah, it fits into life pretty easily.
Yeah.
And for patients who maybe haven't responded well to medications or can't tolerate the side effects, TMS offers this different pathway. It works directly on the brain without those systemic side effects you get from pills circulating through your whole body.
Right, that makes sense. So it's not like you're saying, okay, give up on everything else. It sounds more like adding a really specialized tool to the toolbox, maybe earlier than people thought.
That's exactly it, and that's the shift we're seeing. Referring someone for TMS isn't about waiting until they've failed everything. It's about looking at their whole picture, their care plan, and thinking, is this the right tool for this person at this time?
Mhm.
So yeah, less last resort, much more a proactive strategic step. It can be used alongside other treatments, or sometimes, yes, as a primary approach, depending on the situation.
Okay, that's a really helpful way to frame it. Let's get into that first sign then. This is where it probably hits home for a lot of listeners, the experience with traditional medications. That could be such a tough road.
Oh, absolutely. This is a really common scenario, and it usually shows up in one of 2 ways. First, there's this situation where someone has diligently tried maybe 1, 2, or even more antidepressants. They've done the dose adjustments, they've waited weeks, and they just haven't gotten that meaningful improvement. They're not in remission. Their symptoms are still really impacting their life. For them, TMS provides a completely different mechanism. It's not chemical, it's physical, using those magnetic pulses. And that can make all the difference when the standard approach isn't working.
So a different way in, essentially.
Precisely. The second scenario is medication intolerance. This is also really common. Sometimes a medication does help with the depression symptoms, but the side effects are just unbearable.
Yeah.
We're talking about things like significant weight gain, sexual side effects, feeling sedated all the time, or maybe bad stomach issues.
Things that really impact quality of life.
Exactly. And these side effects can be so bad that people just can't stick with the medication. They might skip doses or stop altogether, which unfortunately often leads to relapse. And here's where TMS really shines. Because it targets the brain locally, it avoids most of those body-wide systemic side effects.
Okay. That makes a huge difference. So if you're listening, maybe think of it like this. Have you or someone you know tried at least 2 antidepressants without really getting better? Or are the side effects so tough they make it hard to even take the medicine consistently? Or maybe there's just this feeling of frustration like, is this it? Is this the best it gets? Those are really strong signals that looking into TMS could be a really important next step. It's about seeing when the current path just isn't working or isn't sustainable. Okay, that leads really well into the second sign, which is about catching things earlier. We hear the term treatment-resistant depression, TRD. It sounds so definitive, but it doesn't just happen overnight, right? It kind of builds up.
You're absolutely right. TRD isn't a sudden thing. It develops over time. It happens when someone consistently doesn't get relief from the standard treatments they try. Their depression becomes more entrenched. But the crucial insight here is that if we can identify signs of this resistance early, we can potentially shorten the time it takes to get someone feeling better. We can intervene before things get really stuck.
So what would be an early warning sign?
Well, a key one might be someone having persistent depressive episodes, even while they're actively working with their doctor, adjusting medications. It suggests the usual strategies aren't quite cutting it. It's a signal that maybe we need to think differently, sooner rather than later.
Okay, so for someone who feels like they're stuck in that cycle, trying things but still struggling, why is getting ahead of it so vital? What's the actual impact of bringing in something like TMS earlier?
Oh, the impact is huge, really, on multiple levels. First, you shorten the duration of the active, untreated, or poorly treated depression. And we know the longer depression hangs around, the harder it can be to treat later on. Long-term outcomes tend to be better with earlier effective treatment.
That makes sense.
Second, intervening effectively early on can help prevent that slide in functioning. Problems at work, pulling back from relationships, not being able to enjoy things. Depression can really erode your life piece by piece, so stopping that decline is critical.
Yeah, preserving quality of life.
Exactly. And maybe just as importantly, it reduces that awful emotional toll of trying treatment after treatment and feeling like nothing works. That cycle of hope and disappointment is exhausting. Getting to an effective treatment like TMS sooner can break that cycle and offer real hope much earlier.
Real hope sooner. That's powerful. Okay, let's talk about the third sign. This one feels really important because it centers on the patient, their choices, their life. Not everyone wants to take medication, or maybe they just can't, right?
Absolutely. And this is a perfectly valid reason to explore TMS. Patient preference and individual circumstances are key. Some people just have a strong personal preference against psychiatric medications, maybe based on past experiences, maybe philosophical reasons. Others might have had really difficult side effects before and are hesitant to try again. And sometimes there are actual medical reasons, other health conditions that make taking certain antidepressants risky or just not possible.
So real medical conflicts.
Yes. And beyond that, some people are just looking for something that fits into their life more easily. They want an effective treatment without, say, daily pills or recovery time. And TMS often fits that bill really well. As we said, it's outpatient. Sessions are relatively quick, about 20 minutes typically.
It's a 20-minute session.
Yeah, and people can usually drive themselves, go right back to their routine. That convenience, plus its effectiveness and non-systemic nature, makes it a really good option for many people in these situations.
So for someone listening, when should this non-medication preference really point towards exploring TMS? What are the specific triggers?
Well, several clear situations come to mind. First, obviously, if a patient clearly says, "I'm looking for a drug-free approach," that's a direct signal. Second, if someone's lifestyle, maybe shift work or frequent travel, makes remembering to take medication consistently really challenging. TMS sessions are scheduled, which removes that daily burden.
Ah, that's a practical point.
Definitely. And third, as we touched on, if there are existing medical conditions, maybe heart issues, liver problems, other things that make medication use complicated or contraindicated, TMS offers a path that bypasses many of those concerns.
It really sounds like it provides a crucial alternative, a bridge for people who need effective help but want or need to avoid the pharmaceutical route. It gives them a real choice.
It does. It empowers patients with more options.
Okay, so we've laid out these three key signs. Issues with medications, either not working or side effects, those early hints of treatment resistance, and then this clear preference for non-drug options. If we pull back and look at the big picture, what does this all mean for how we approach mental health care overall? Why is being proactive, stepping in earlier with something like TMS so important?
Well, the biggest reason is that waiting until someone has tried and failed everything. It just prolongs suffering unnecessarily. And honestly, sometimes waiting too long can make depression even harder to treat effectively. It can become more entrenched, more resistant.
So delaying can actually make things worse.
It can make recovery more difficult, absolutely. And what we're seeing now, which is really encouraging, is that as the evidence for TMS keeps growing stronger, more and more providers are recognizing this. Forward-thinking psychiatrists and clinicians are starting to see proactive referral as the better standard of care. They understand that knowing when to offer TMS can get patients access to a safe, proven, effective treatment much sooner. This leads to better response rates. It helps people maintain their quality of life, their jobs, their relationships, and crucially, it gives back hope. Hope when maybe other things haven't worked out. It's about a more effective and, frankly, more compassionate approach to care.
That makes so much sense. It does raise a bigger question, though, doesn't it? How do we, as a whole system, patients, families, doctors, get better at recognizing these opportunities? How do we make sure people know about options like TMS earlier so these chances for effective intervention aren't missed? It feels like there's still an education piece needed.
There definitely is.
Yeah.
Open conversations, better awareness. It's all part of it.
So, wrapping things up a bit, whether it's dealing with those medication challenges, spotting the early signs that treatment isn't quite hitting the mark, or simply wanting a non-invasive approach, TMS really does seem to offer a powerful, evidence-based solution that should be on the radar. And maybe here's a final thought to leave you with. If there's a treatment out there that can genuinely improve someone's life, maybe dramatically, and give them hope back, why wouldn't we want to ensure it's considered at the right time instead of potentially waiting until it feels like the absolute last option?
That's the core question, isn't it? We really do encourage you, if any of this resonates, talk about it. Talk to your doctor, your therapist. See if this approach might be right for you or someone you care about.
We really hope this conversation has illuminated an important treatment path. And if you'd like more information specifically on the Blossom TMS therapy system, you can find that at blossomtms.com. This discussion was brought to you by Sabres Medical at blossomtms.com. Thank you so much for tuning in and joining us for this important discussion today.